Hello. Good morning, everyone. Very nice to see you all. So first of all, I would like to thank Pro Shahida for inviting me to come over. I would also like to thank Dr. Nick for negotiate everything and then make this happen. My name is Ko Eng Ho. I received just a brief introduction about myself. So I graduated from Taiwan, National Taiwan University, and then afterwards I worked in hospital for 2 years. Following that, I further studied at UK, at the University College of London at Eastman Dental Institute, where made me the junior of Pro Shahida, where I received my MPLIN, my EFP diploma, and also the membership. I said it separately. So I actually just came back 2 years ago to serve Malaysia. So recently also registered as a dental specialist in periodontology. So I'm grateful for this opportunity, and also thanks Linko, the C Global company, for giving us the sponsorship for the samples. Yeah, we provided later. Okay, so later, just to make this session more interactive, I will invite Dr. James later to come over, and whoever I think some of you already listened about the product. So later, if we manage to have some interaction, maybe we'll give away some sample. Okay. So first of all, that I would like to welcome our colleague from USU, University Sumatera Utara. So this is the photo that I searched online. Is this correct? Is it a real one? The Google? Yeah. No? Oh, correct. Okay. Yeah, so I wish I have the opportunity to visit your school one day, your university one day. Okay, so just a small brief introduction about the faculty where I did my postgrad training. So this is the old sites of Eastman, which is located at Gray's Inn Road. Okay, so this hospital used to be the biggest dental hospital in Europe. And if you look at the old site inside, actually, okay, this photo is not too clear, but you can also see there's a water fountain at the patio area. And then they moved to the new building in 2019 at Hunley Street because they want to combine the ENT hospital and the dental hospital. Actually, myself haven't got the opportunity to visit the new hospital yet. Yeah. So let's see what happened to the old site. Unfortunately, because they want to expand the site. Yeah, Dr. Kwek probably can feel it. I think they removed part of the Victoria wing so that they can extend the building to a new building. Okay, so this is how it looks like now, and I believe the construction is scheduled should be finished by this year, and they will have it occupation next year, hopefully, if there's no delay. So maybe by that time, and they say by that time the water fountain in the middle, they will move back. And then let's see how it goes. Yeah, so this is actually the UCL Eastman family. Dr. Shahida, you are there, right?
I was there.
Yeah. So actually, I was here, and then Dr. is here. So we actually just reunite with each other at the Scape. But actually, a few years ago, 2018, we went to the Europerio 9. Yeah, where it was such a great time, reunion. Yeah. Yeah, you can see how big the family is. So, in this 2018, apart from this happy reunion, actually it was in my final year. It was a very stressful year. And you know, when it's also the time that the new classification came out. Actually, in the first 2 years of my training, I was using the old one. All of a sudden, in the final year, we need to have this new classification. Yeah, so this is actually the scope of the diagnosis, the treatments that we're dealing with patients. You can see, wow, there's so many of them. So with this new classification, they also came out, the EFP also came out with some clinical recommendation, which make our treatment plan, everything can be more systematic. Okay, so this is the EFP clinical guidelines. We can see that, very important that that is just as what our topic today is patient supragingival dental biofilm control, which is very important. Yeah, so we always know that the first time we see our patient, we need to teach them how to brush their teeth. Okay? So, and actually in the same guidelines, we can see that in the same, they're just at a different section, they reinforce again how important it is for oral hygiene towards our patient, so that their condition, their disease can remain stable. So that is how important my topic is today. Okay? Okay, so now before I start, so we just want to talk a little bit about history of toothbrushing. Do you guys have any idea when we have the first toothbrush in the history?
China.
Yeah, China. Well, yeah. Dr. James, yeah, she said China's can we give? Okay. Yeah, later. Yeah, Dr. James knows. Okay, so yeah, China. Yes, the first toothbrush, actually the proper toothbrush was from China. Okay, so but I'm going to start my story a little bit back then. Okay. Yeah, so the history of toothbrush actually starts from Egyptian 5,000 years ago, which is 3000 BC. They actually make the brushes by chewing against the twigs, so to make the ends of the twigs frame, so that they can use the brush to clean against the tooth. They say that according to the books, that the chewing stick is still the ancestor of the miswak, which is used today among the Muslim community. It's used for the religion purpose. Is that correct? Yeah. Yeah. Okay. Yes. So this, according to this picture, this is the frame ends of the twigs, which is used to clean their teeth. Okay. So, and then the second is, yeah, the doctor was correct. The Chinese was believed to invented the first toothbrush. Okay. So this is actually the first toothbrush that we can see in 1600 BC. This toothbrush is made from animal hair, and then afterwards they're attached to a bond of bamboo. Okay. Even though we know that just now the Chinese created is 1600 BC, actually it takes a very long time to arrive in Europe. So unlike the COVID-19, it just takes how many weeks just to spread across the globe. Actually, it takes centuries for the toothbrush to arrive in Europe. So it's actually this English merchant, William Actis, he actually got into kind of like a quarrel with other people, so that he was locked down in a jail. So when he got the time, and then he got the time, and then he tried to get some help from the guardians and from the security, and in the end, so he invented this. So he also got a very good business mind. So he's not making it for himself, he also make it into an enterprise. So he apparently he made a lot of money. It became a very prosperous business. And actually this toothbrush, it was the toothbrush it looks like by that time. But this company actually still exists today. So this is actually the photo that I looked from Amazon. So this is the new Addis smokers, extra hard. They designed it for, yeah. So just now we were saying that about the softness of toothbrush. This is extra hard. So I do not know if that's the connection, because they designed it for smokers to help them to remove stain better. Okay. So yeah, so even from the last picture, all the toothbrush actually still made from animal hair, the bamboo or anything. But luckily we got this guy, this brilliant chemist. Okay, so he invented nylon in 1935 under this company DuPont. But yeah, it's just that when other people see him so successful, but he just haunted by depression. Actually, despite all the success, he took his own life 2 years after he invented nylon, such a very important thing. We use it every day. Apart from toothbrush, what else do we use for nylon? Suture, yeah, yes, a lot of, and many things, even all the clothes, many. So this is how bad depression can get. Okay, So even though we already have very good nylon in 1937, but people still not used to brushing their teeth. So it's very hard to imagine that actually only after World War II only after World War II they start to brush their teeth every day. So I was thinking that it could be because they do not want the soldier out suddenly have a toothache. So then they force them to brush their teeth every day, and they bring this habit back home. Otherwise, they were still using the saw to brush against their teeth so that to maintain the hygiene. Okay, so now we know that actually only after this World War II, then only they get the brushing things get some attention. So then let's see. After this, actually people was thinking about brushing technique. Do you guys can you tell me any of the toothbrush technique?
Buzz.
Anyone can tell me?
Buzz.
Buzz. Okay.
Human.
Dr. James, Dr. Wong said buzz technique.
You should also say buzz.
Modified buzz.
And then what else? And also just now.
Stillman.
Stillman. Stillman. Okay, Stillman. Okay, yeah. Dr. James Stillman. Okay. Never mind, Dr. James will come over. So, is there any correct way of brushing teeth? So there are different types. It's horizontal, you can brush your teeth horizontal, rotary, vertical, or vibratory. Okay, I'm sure that of you here are doing periodontology, you are pretty much familiar with it. But just have a look at it. Okay. So horizontal brushing, I'm sure that a lot of your patients, when they come to your clinic, if they haven't received any oral hygiene education from the dentist, they always brush their teeth like this way. Okay? So it's pretty much to press the brush perpendicular to the tooth surface and then horizontally. Okay. Yeah, I'm sure you're pretty familiar with this, but just to make sure we are on the same page. Okay? So sorry, no, this one. Okay, it's horizontal, it's fine. Okay, so the vertical brushing technique, which is actually same. The toothbrush, the bristle is pressed perpendicular, but it's using this up and down. Okay? So this vertical brushing is also called Leonard's technique. So do you see this patient brushing like this? Yeah, I think we see them more brushing horizontally. Okay, and then another one is circular brushing. Okay, this is actually recommended for like children, kids, because it's easier to prosecute. So basically, you have, when you put the toothbrush in, so you have your mouth closed, and the toothbrush is underneath the cheek, and then brush circular. Okay, we have some demonstration here. Okay. So circular, so yeah, it's easier. So that's why we always teach all the kids, or even the patient. Just now I remember doctor asked us about the special needs patient. Even all the carer will suggest them to brush patients with special needs to brush it circular way. Okay. Okay, the other one is the one that Dr. Wong mentioned just now, modified base technique. I'm sure all of you pretty much familiar with this. So it's how the degree is 45 degree, and then at the circular gingival sulcus, and then brush this way. Okay. Okay. So this is a quick video.
We're going to review the brushing technique, mass. The technique that we actually use is modified mass. This technique is used for the patient that does not have recession. The toothbrush is placed at a 45-degree angle into the sulcus. The patient will then wiggle the toothbrush 3 to 5 times and roll down. The mass is placing the toothbrush at a 45-degree angle into the sulcus. The modified is the roll down. So we use a modified mass 45-degree angle into the tissue, into the sulcus, and roll down. The amount of brushing that is required in an area is determined by the amount of plaque that is on the teeth that we need to remove. We want to overlap as we move around the mouth to ensure that we're getting every area and not missing. We're going to do the same motion on all the labial and buccal areas. Also the lingual, the exact same motion is used. The lingual anteriors, we're going to use a heel to toe motion. They were going up and down to clean the linguals, lower and upper. We use this motion rather than the modified bass because often a toothbrush is very difficult to fit into these anterior areas.
Okay, actually from this video, you got some important point is modified bust is actually recommended for patient who doesn't have recession because it's very hard for patients themselves to control the force really well. So it might make the recession even worse. The second thing is when the patient brush their teeth, they need to overlap because sometimes they just move set to set without overlapping. So they might miss some of the section. And also the other thing is we know that it's about 20 to 30 circular stroke. But how many times it really depends on the plaque accumulation. So if the patient, the oral hygiene is not that good, they might need to go a few more times, okay? So this one, everyone's familiar with this. So the next one I want to introduce is the Charter's technique. So Charter's technique is the brush is positioned in an oblique direction towards the occlusal or incisor surface. And so when they brush, they pretty much flash the filaments gently to the interproximal embrasure area so that it can clean really well. So let's see this one, how it works.
45 degree. Apically. This is apex, this is crown, this is towards the tooth. That is known as coronal, towards the gums, known as apical. So this is 45 degree apically, but in Charter's technique, we keep exactly opposite, 45 degree to coronal side. This is basically, we use people with orthodontic brackets who underwent the periodontal surgery in order not to disturb the gums much. So the same method we use Charter's technique, back and forth motion, just clean the gums and not much cleaning the cervical or gum area. That is Charter's method. Now we
Okay, so the main point is for the Charter's method is when it start with, it's facing towards the crown. So actually it's designed for the patient that, okay, for example, right after the patient having some periodontal surgery, we really do not want the patient to brush against the gum, to touch the gum at all. Then that is the technique we can use. And also the other types of patient with wearing braces, they can also use this one because then when you brush, then they can really brush to the niche of the braces. Okay, but some of our patients, even though we did ensure how they brush their teeth, they just really do not quite get it how they should brush. And then this is what we very often, we can see quite frequently amongst our patients. So with some gingival recession and also with some non-carious cervical lesion. So that's why people come with this kind of like Stillman technique. So Stillman technique, actually, if you oversee that, is actually very similar to the bust technique, but when you, but the Bristol filament is not engaging with the clavicular area. It's not engaging with the sulcus area. So and also the difference between this one, actually this one you can see that it's very similar to the roll technique I'm going to talk about later. But it's just this one, it has the vibratory movement. So that is maintained, the toothbrush, the bristle when you brush, is maintained in position with the tooth.
slightly different from past technique. Okay, so in past technique, we engage the bristles into gingival sulcus. Okay, 45 degree. The bristles will be entering into the gingival sulcus. But in Stillman method, the anchoration is same, that is 45 degree. But we will not insert the bristles into the gingival sulcus. We keep the bristles partly on the gums and partly on the teeth. Then we'll do the same action. So it is basically for people with gingival recession for more cleansing of those receded areas. In gingival, sulcus penetration is ideal method, that is using a modified Barnes technique, but here the penetration of bristles into the gingival sulcus is not there. And rest everything is same. You need to do a 20 strokes at a time and 3 to 4 teeth or 2 teeth always overlap the teeth. Then do the crucial sweeping action. That will become modified Stillman. Without sweeping action, it will be just Stillman method.
Okay, so yeah, just like what mentioned just now, the Stillman methods is you don't put the bristle against sulcus. However, I find that clinically it's very hard to differentiate because when you brush it, how can you feel, am I really touching the, because after I actually prepare for this topic, every day when I brush I was thinking, what technique I'm using. Yeah, so yeah, this is Stillman technique. So when the modified is whichever come with the sweeping motion, then it's the modified. So the next one is the roll technique. It's the patient when they have gingival recession. So you definitely recommend them to use this technique because by using this technique, you are not engaging the sulcus the gingiva at all, so that you are not making things worse. So you can see that when they brush, okay, when they start, part of the toothbrush is pressed against the gingiva, part of it is just next to the tooth, and then you do a sweeping motion, okay? But the difference between the rolling technique with the previous one is it's just sweeping only. It doesn't do the vibratory movement like just now. Okay, that's my first one.
Joe Neiman, I'm a periodontist in Southfield, Michigan. We treat a great deal of gum recession cases. I love it and I do a lot of it. But people have to know how to clean and brush their teeth if they have a problem with gum recession. Too many people scrub too hard or scrub the wrong way and cause the gum recession or cause it to get worse. If you have gum recession, don't scrub hard, don't scrub around, don't scrub back and forth. On the upper, scrub down, like you're bringing the gum down. And on the bottom, scrub up, like you're bringing the gum up. Same thing on the inside. So that's the tip for the day. Very careful with your brushing, soft brush. I do not recommend an electric brush for anybody with a gum recession problem. You can't control it so well. So a soft manual brush, brushing carefully, will give you your best chance of avoiding gum recession and preventing it from getting worse if you already have it.
Okay, so yeah, he also got some key point here. So when we have patients, they have gingival recession, we really ask them not to use electric toothbrush because yeah, it's very hard for patient to control it. So then it's manual soft toothbrush. Okay, so it's suitable for them. Okay, so the next one, actually, yeah, I'm just going to ask you some questions and then whoever can answer my question, we will give away some gift. Okay, yeah, because you know, I would appreciate if you can raise your hand, yeah, so that we can. Okay, which technique is this?
Horizontal.
Okay, yeah, horizontal. Okay, we okay, yes, very good, horizontal. Okay, yeah. The first two is easier because I use the same video. Okay, so we give to the whoever you haven't had it yet.
Circular?
Okay. Circular. Okay, circular.
It's okay.
Yeah. This doctor already answered a few times. We need to give a present.
Okay, thank you.
Okay, the next one is a bit hard, I think. I personally think it's a bit hard. Okay, charted. Yeah, very good. Yeah, because it is facing towards the crown area.
Next time when I do my lecture,
By mistake. Okay, this one. This one, huh? Okay, who can anyone like? Okay, roll technique. Roll technique. You already have the present. No, not yet. Yeah, not yet. Okay.
Thank you.
Okay, the last one. Okay. Modified bus. Okay, yeah. Okay, very good. So everyone already know the technique, the brushing technique. Okay. Okay, let's move to the next one. Sorry, it just doesn't move. Okay, yeah. So we have a conclusion here, actually from the same workshop, the mucogingival condition. Yeah, the brushing technique, if the patient didn't brush their teeth properly, the improper brushing methods is the most important mechanical factors contributing to the development of gingival recession. No matter if the patient uses a very soft toothbrush, if they brush their teeth too aggressively, they will also cause gingival recession. And also, apart from that, bristle, hardness, brushing technique, these all will be related to the mucogingival condition. Okay, now we talk about hardness of the toothbrush. Okay, so actually as late as 1967, people were still buying hard toothbrush. So that's why, this is just part of the example, okay? So they are still buying the hard toothbrush. It's because people believe that if you brush your teeth better, then you can avoid all the disease or the caries. But when suddenly the development of the knowledge, they know that actually gum disease is caused by the calculus plaque underneath the gum, then they know that they need to brush their circular area very well. So they know that they have to shift to the soft toothbrush. Okay. So the filament ending. So just now, whoever, if you managed to listen to Dr. James next door, there is a trend for the toothbrush nowadays to design their toothbrush in taper ending. This is because the taper ending, it can make the base a bit wider, the tip a bit thinner, so that it can have a more flexibility. And also, when it is thinner, it can go to the circular area better and go to the interdental area better. Because when we do oral hygiene for our patient, we're pretty much sure that we always teach our patient to do interdental cleaning. But some of them just not doing that hard working. So yeah, this kind of like filament ending with the taper ending, it does help. Okay, so apart from the gingival recession, the same photo which you see just now, apart from the recession of the gum, we actually can see the teeth. So, okay, what are these? Okay, anyone can answer me? What are these? Just now, who haven't answered yet? Who haven't got the present yet? Oh. Okay, doctor? Yes, yeah, abrasion, yes. Yeah, so this abrasion, so just now what I'm going to talk is focused on the tooth structure. Okay, so I think we pretty much very frequently see our patient with this kind of non-carious cervical lesion. So what is the percentage of that? It's about 50%, almost 50% of our patients. So that's why it's very important for our sponsor to have this kind of toothbrush, very soft toothbrush for our patient. Because many people, they do not know how to brush their teeth in modified bars, they just like horizontally, okay? They brush away everything, the gum, the teeth, the pulp, everything. Okay? So, same. So the effect of toothbrush bristle, stiffness, is it causing more? Yes, they actually have a conclusion. This paper, they actually say that the soft bristle toothbrush tends to cause less abrasive wear with the increasing brushing force. Because for this study, they actually increased the force a lot and then moderately. They realized that even though how much it increased, the soft toothbrush is still cause less abrasion. Okay, So are the bristle stiffness and the end shape related to, so just now we discussed about, is it tapered, is it end, free end, and then what is the design? They know that anyway, the soft and extra soft toothbrush tends to be safer. When you clean your teeth, it's always safer to avoid all the condition we have. Okay, so finally, just now we see next door with the Lincoln toothbrush. This is the toothbrush that conducted by Lincoln company, and so this paper was published in 2018. Okay, at the Korean Society of Dental Hygiene Science. So they want to investigate effects of ultra soft and soft toothbrush on the plaque removal and the tooth abrasion. So this study, they actually divided into two parts. One is the cleaning ability experiment. Okay, it's how clean the tooth is. The second one is the abrasivity experiment. It's just now, Dr. just answered, is abrasion. They want to know that how much the toothbrush might cost. Okay, so we see the material and methods. So they have two types of two group of toothbrush. One is the ultra fine processed toothbrush, which is the kids toothbrush and gum toothbrush. Actually, if you can see whoever will receive the gift just now, yeah. So the inside there is actually the gum toothbrush. Okay, so they have two types. One is for the kids session, the other one is for the gum session. Okay, and for the soft toothbrush, they use the Oral-B Kids, and the other one is the Korean 2020. So what is the difference between these two categories? Actually, they have a very similar bristle tip, which is less than 0.01, but it's just the base is different, so that the way it's tapered. So the Lincoln toothbrush is 0.11 to 0.12, and the other one is 0.18 to 0.20. Yeah, it's about 20 huge difference. Okay. So we can see that how they test the cleaning ability. Okay, so this is the model. They have the model. Yeah. This is the virtual study. So you can see that this. Have you guys used the RT spray in your clinic? I never seen this before. Yeah. So it is actually like articulated paper. It's just something you just spray. Like sounds like more high class, right? So it just spray. So it's like, so its name is RT spray. So you spray like 5 seconds. Okay, after 5 seconds, right? For 5 times. Then they use the toothbrush. So they have two categories. One is the kids category. So the kids category, then maybe they test with the Lincoln first, then with the Oral-B, and then afterwards is accordingly. Okay, they have two groups. And they use this PHP, so patient hygiene performance. I think we do this every day, right? Every time patient come, then we do the pet control and then see how the patient brush their teeth. So that after that, spread this, brush, and then assess. So the other one,